Welcome to GDOH Health Information System, SAP ISH, MED, Clinical Module, Patient Profile Navigation section. To view the patient navigation profiles, first thing that you need to do, you need to make sure that you are currently in a work environment that you want to operate in. The first thing is to open up the particular work environment. If you're an inpatient, make sure that you click on occupancy. Once you have clicked on occupancy, then the occupancy work environment will open up. Then what you need to do is to select the particular patient you want to view the patient profile for. After highlighting and selecting the patient, you then click on the patient profile button to open up the patient profile. Once you click the patient button profile, then the patient's profile will then open up. Once the patient profile opens up, you see that the patient profile dashboard is split into 5 sections. So I'm just going to collapse and you'll be able to see the particular section that we're talking about. The first section is this header section, which we have at the top. And on top, you have the patient name, the particular date of birth of the patient and the patient number. Then below that, you've got the risk factors. If there are any risk factors that are captured, you'll be able to see how many risk factors that are captured. Same with the allergies, you'll be able to see the allergies that have been captured. Then after that, you'll be able to see where the patient is currently within the facility. Then you've got the case number. Then you've got the case type. Depending on the type of case, it might be inpatient or outpatient, or it can be an accident and emergency. Then you've got the patient classification. Then below that, we then have these 4 sections for the dashboard. The first section that we're going to touch on is the application section. Under the application section, this is the section where you're able to capture any of the patient details and be able to view some of the details that you'd have captured. It is split into 3 subsections. You've got your clinical information section, and you've got your patient information section, and lastly, you've got your documents, clinical documents section. Under the clinical information section, we've got allergies, where you're able to capture the allergies the patient has. You've got your risk factors, where you're able to capture the risk factors. You've got your diagnosis, where you're able to capture the patient diagnosis. Then you've got your progress entry, where you're able to capture the progress entry notes for the patient. You've got vital signs, where you're able to capture the vital signs for the patient. You also have the create clinical order that allows you to be able to create the clinical order for surgery for the patient. Then on the patient information section, we've got patient data. Patient data, this allows you to view the patient master data, which will give you the demographics. And as a clinician, you're able to change some of the demographics. For an example, you can be able to change the address and the telephone number if required so. Then we've got patient appointments. Under patient appointments, you'll be able to see the current and the future appointment the patient has. Then we've got case list. Under the case list, you're able to view the historical case movements that the patient would have done in the institutions. So all the historical cases that the patient has visited the facility before, you'll be able to see them under the case list. Then, under the subcategory clinical documentation, it's split into 4 categories. The first one is outpatient. This is where you'll be able to see all these and capture all these outpatient clinical documentation. Then we've got the MOU, where you're able to capture all these MOU related documentation. Then we've got hospital. Under hospital, we are able to capture all these hospital documentation. Then you've got surgery, where you're able to capture all these surgical documentation. So then we move on to the subcategory for progress notes. Under the progress notes, you see that all the captured progress notes will appear under the progress notes. This is where you see all the progress note entries that have been captured by the clinicians for that particular patient. Then we move on to the vital signs. Under the vital signs, it's also split into two categories. You've got your vital signs, where you will be able to see all the captured vital signs for the patient. And of note, you see that any vital signs that are highlighted in a particular color, these vital signs show either they are out of range, which will be the normal range. But the ones that are not highlighted, it means they will be inside the normal range of those particular vital signs. Then, still under this section, we have also the smart chart, which allows you to be able to view the patient smart chart. And the smart chart is split into two, where you've got your diabetic control chart, which allows you to be able to view the smart chart for glucometer and insulin. Then we also have the vital signs smart chart, which allows you to be able to view the smart chart for whatever vital signs that you might have captured in the system. Then we move on to this section, which is split into three subcategories: documents, diagnosis, and physician therapeutic orders. So under the documents section, this is where you'll be able to see all the clinical documentation that you'd have captured. They'll appear under the documents. As you can see, things like safety, as an example, safety check, surgery log, water log, all these are clinical documentation that would have been captured by the clinician. And to note, where you see a pen, it allows you to be able to change that particular documentation. And where you see a little man with a green tick, it allows the clinician to release that document as the final documentation. Then when you see a little printer icon, this allows the clinician to be able to print that particular clinical document that would have been captured. And lastly, we've got a dustbin. Well, on the dustbin, this is where you can be able to delete that particular clinical documentation. Then under documentation, you can be able to filter based on the document category. If you click the drop down, if you only want to see a particular document category on its own, you can be able to select that particular category and only see that particular category. And if you want to clear the filter, you just click on clear filters. Then it will clear the filters and take you back to the original state. You can even be able to also filter based on employee responsible. If you click there, then you can choose the particular clinician and be able to see the only documents created by that particular clinician. So if I click on this one, then it will give me only the documents that have been created by that particular clinician. And I can clear that as well. With the status as well, you're able to filter to see the documents that are exam registered. That means they've been captured. They have not yet been released as the final documentation. And the ones that are released are the ones that are final documentation. So if you want to also see based on the status, you can be able to select the particular status and be able to view only that particular status. For an example, I've just selected released. These are the only documents that have been released by the particular clinicians. And the only thing that you're able to do is to print, and you can't change or delete those particular documentation. Then we move on to the ICD-10, ICD-10, where we see on the diagnosis, we see the diagnosis, all the diagnoses that have been captured for that particular patient, they will appear under the diagnosis subcategory. And you'll be able to see them on here. And then we move on to the physician therapeutic orders. Under physician therapeutic orders, this is where you'll be able to see all the physician therapeutic orders that have been captured. Of note, you see that the same thing that applies to the documentation. The pen allows you to change the little man's head with a green tick for releasing the document, and the dustbin for canceling or deleting that particular order. Then of note on the status, whatever order that has been written, a status entered, it means it has not yet been released to be executed by the particular occupational group. The ones that are released are the ones that the particular occupational group need to execute that particular order. And the ones that are written executed are the ones that the particular occupational group would have executed. So these are the sections that are currently on the patient dashboard. So for navigation, you just need to go to the particular section that you need to go to in order for you to be able to execute or view the particular thing that you want to see pertaining to that particular patient. We'll then move on to the next items in the next video.